What if I told you that nearly 1 in 3 adults over 65 live with daily joint pain, and that long-term inflammation is one of the top reasons seniors lose mobility, stop walking, or need costly joint surgery? Research shows that persistent joint inflammation increases the risk of 2x higher disability, 40 to 60% higher risk of falls, faster progression toward knee and hip replacement. Many seniors are told, that's just aging. But here's the truth. Backhand index pointing right, a quiet fire is burning inside the joints, and it can be cooled. Today, we're uncovering the anti-inflammatory spice almost no one mentions, how it works in the body, and how some studies show meaningful relief in about 10 days when used properly. Stay with me, because ignoring this problem doesn't just mean pain. It can mean losing your independence. Before we continue, I want you to meet the medical authority guiding today's discussion. Dr. Maya Hassan, board-certified rheumatologist. Over 22 years treating joint disease. More than 18,000 patient consultations. Known for combining evidence-based medicine with nutritional strategies. Reports that over 70% of her patients see improved pain control when lifestyle and food-based strategies are added to treatment plans. She reminds us, medication helps control symptoms, but nutrition and inflammation control are what protect the joint long-term. This gives us credibility and direction. Think of your joints as hinges covered with smooth cartilage. When you're young, a cushiony fluid keeps everything gliding easily. After age 60, cartilage thins. Inflammation chemicals called cytokines increase. Blood flow to joint tissues decreases. Your immune system becomes more reactive, creating what doctors call inflamed aging. This inflammation doesn't just hurt. It eats away at cartilage, the protective layer in your knees, hips, shoulders, and hands. The body responds by stiffening the joint. The more you avoid moving, the weaker the muscle becomes. And the joint gets even more unstable. It becomes a cycle. The good news? Some compounds found in natural foods can help block inflammatory pathways, reduce pain signaling, and support joint repair. And one spice stands above the rest. Frequent use of certain pain medicines can irritate the stomach, raise blood pressure, and stress the kidneys, especially after 65. Studies show long-term use of some NSAIDs may increase cardiovascular risk by 20 to 30% in seniors. John, age 71, took daily pills for knee pain. His relief lasted hours, but his swelling worsened over time, and he developed stomach bleeding. Once he switched to an anti-inflammatory nutrition plan along with medical guidance, he cut his medication in half and walked comfortably again. Highly processed foods, sugary drinks, and trans fats trigger joint inflammation. Diets high in refined sugars increase inflammatory markers by up to 60%. Maria, 68, believed her knee arthritis was genetics. After eliminating sugary snacks and adding anti-inflammatory spices, her morning stiffness decreased dramatically, and she postponed knee surgery. Too much rest weakens support muscles, making pain worse. Studies show seniors who stay gently active reduce joint pain by 20 to 30% and maintain flexibility longer. Harold, 73, stopped walking because of pain. Within months, he needed a cane. When he restarted gentle movement and reduced inflammation, his stability improved and his pain dropped. The spice we're talking about is turmeric. Curcumin, the active compound in turmeric, has been shown in multiple block inflammatory enzymes, COX-2 and NF-kappa B, reduce swelling in joints, improve mobility and stiffness, act as an antioxidant protecting cartilage cells. Several controlled trials found that standardized curcumin extracts improve joint pain as effectively as some pain medications, with fewer side effects, and improvements often began around 10 to 14 days. Always talk with your doctor first, especially if you take blood thinners, diabetes medication, or have gallbladder issues. Look for a standardized curcumin supplement, 500 to 1,000 mg/day, with black pepper, piperine, or labeled bioavailable. This helps absorption by up to 20x. Take with meals. Stay hydrated. Maintain gentle movement 10 to 20 minutes walking or stretching. Less morning stiffness, reduced swelling, better walking comfort within 10 to 14 days, and better results after 6 to 8 weeks. Include turmeric in soups, lentils, eggs, smoothies, warm turmeric milk, unsweetened. Combine with a pinch of black pepper and a healthy fat, olive oil, for better absorption. Increase omega-3 foods, fish, walnuts, flax. Reduce sugary snacks and processed meat. Keep joints moving gently daily. This creates a powerful anti-inflammatory environment in the body. If you're finding this helpful, don't forget, thumbs up like this video so more seniors can discover it. Bell subscribe. We make science-backed content for adults 60 plus. Speech balloon comment below with your age and your biggest joint problem, knees, hips, or hands, so we can tailor upcoming videos for you. Our channel exists to help you stay mobile, strong, and independent. Here's the truth many seniors never hear. Joint pain is not just aging. It is inflammation, and inflammation can be influenced. By understanding your body, avoiding hidden triggers, and using proven nutritional tools like turmeric, you can walk further, sleep better, avoid unnecessary medications, delay or prevent surgery, maintain independence. Imagine being able to get out of a chair without wincing, to walk with your grandchildren again, to stay in your own home longer without needing assistance. That's what controlling joint inflammation can do. So stay with us. Take control of your health, and remember, back-end index pointing right, small daily choices today protect your mobility for tomorrow. Make sure you subscribe, stay tuned for our next video on reducing inflammation naturally. And, as always, talk with your healthcare provider before starting any supplement. Stay strong, stay hopeful, and I'll see you in the next video.